Same methodology that this is to protect the public. And they gave justification, contamination of the foods if we don't regulate it, contamination of this, of the drugs if we don't regulate it, which gave good justification for some regulation of different things to protect the public, which most people agreed with. The problem is that over time, the people with the most power and influence were able to influence the regulatory agencies, so they were not looking after the public, they were looking after the person supplying the most money. And usually it is the very agencies that they're regulating. For instance, the Food and Drug Administration, what we've had, and there's been a number of books written on it, a number of exposés on it, is that individuals of the FDA will be receiving either promised jobs when they retire that are very lucrative if they'll just pass this drug and give it the okay. This has gotten so bad now, we have just numerous drugs have entered the market and harmed and killed tens of thousands of people, which when the investigation looks at it, they found out in fact they knew this drug was harmful before it was ever approved. The early studies, some of them had been faked by either the companies being investigated and the FDA was aware of it, or the early studies did indicate that these dangers were there. They approved it anyway, and then once it entered into the marketplace, thousands of people were harmed. You may remember some of the anti-inflammatory COX-2 drugs. One of them came out on the market, and it's estimated as many as 80,000 people died of a complication that was known before the drug was ever approved, and it was known by the FDA regulatory agencies. So we have a number of cases in which the regulatory agencies were being heavily influenced by the people they were regulating. This is true with the Superfund. There's a number of studies looking at EPA and Superfund in which the people doing the polluting, they're not corrected. They just pass over it. And I've looked into some of this myself with some of the regulatory agencies, for instance, vaccine contamination. I looked up some of the FDA records on the investigation of the people that were supplying components of the vaccine that were heavily contaminated, either with hepatitis virus or at risk of the mad cow prion contaminants. And what the FDA would do would go into the company, identify the danger that they were collecting specimens that were contaminated or high risk of contamination, and then they would just write up a report and never come back and see if they had corrected it. So they're allowed to continue the practice without any fine, without any follow-up to see if this had been stopped. So this is one of the other reasons I worry a lot about vaccines, because there's indications that they're highly contaminated. They're using contaminated serum to make it by getting this from small labs all over the world in the United States. And there's been numerous cases in which, for instance, a vaccine in the UK, they found out that one of the people that they were getting the serum from died of mad cow disease. And their response was, well, we don't think it's going to cause any problem, but tens of thousands of people had received that vaccine contaminated with the mad cow. So, what we call this is the revolving door. One of the best demonstrated examples, and you can find this on Betty Martini's site, Mission Possible. If you go to that site, you'll find the full document reproduced. And so when they were doing the first approval of aspartame, when it was made by G.D. Searle Company, they told G.D. Searle, do some experiments and present them to the FDA, and we'll see about approval. Well, they did the experiments and studies on mice, and they presented to G.D. Searle, and a board of scientists, which included neuroscientists, said, well, we don't think this should be approved because there's a very high incidence of brain tumors in animals exposed to aspartame, and other tumors as well, and some other problems. Well, the chairman of that scientific committee overrode their decision and approved it anyway. And then shortly after that, I think within 3 to 6 months, he went to work for the PR agency for G.D. Searle. So this was sort of the revolving door in how aspartame ever got approved in the first place. Now, a government regulatory committee was asked to look at this and see if indeed there were an increased number of brain tumors. And so they went back and got all the G.D. Searle slides, all the material that was used for these studies, and they found out that many of the slides had been destroyed that had tumors in them. They found out that the people that were doing the examination of the slides were not qualified, that the studies on the effect of aspartame on developing babies was done by a person who had no experience whatsoever in examining the embryologic effects of this toxin, and that there was evidence of numerous types of tumors being induced by aspartame in these studies. This report was locked up in a file cabinet. No one was allowed to see it until a Freedom of Information lawsuit was filed. It was released. When it was released, it demonstrated all these things. I've read it myself, so I know what's in it, and it's all true that they were destroying specimens, hiding tumors, lying about what was found. And that's the sole basis of the approval of aspartame for use today. It was known that it's a carcinogenic agent. They were known at the time that it produces damage to the brain, that it contains excitotoxins. Repeat studies recently have shown that it increases the incidence of a particular deadly cancer, lymphomas and leukemias, possibly brain tumors, and possibly breast cancers. That has been since repeated in even a larger study by a very prestigious research group confirming that this does produce cancer in these animals. We know that the aspartame contains breakdown products, DKP, and formaldehyde that latches to the DNA, damages it, and so we have a good explanation of why it's producing this high incidence of cancer. We also know the mechanism for it producing damage to the brain as well. And there's been numerous human cases of cancer that seems connected to the aspartame, particularly brain cancers. And we've seen an increase in the number of brain cancers since it's been approved, particularly in young people. So this demonstrates again this revolving door mentality. Is they approach people that are in positions to get products approved that are dangerous. They use their money and influence, promise of jobs to get it approved, and then that person leaves and goes to work for the company. So the public is being deceived thinking that modern regulatory agencies are protecting them. They're not. They're protecting the people that they're supposed to regulate.
Doctor, going back to the collusion and the revolving door issues, Wolfgang Vodarg of the Council of Europe initiated an official investigation into the H1N1 vaccine, saying that it had been pharmaceutical people falsely rising the level of the pandemic and causing the WHO to put out the mass alert and push this whole thing. Could you talk about the swine flu? I won't use the word, I'll suggest the word hoax, but of course, tell us what you think about it.
Well, I think it was a grand hoax. Now that we're looking in retrospect, the idea that it was a pandemic is being attacked by a number of people, that there was no evidence that it was a pandemic. And as I appeared on one of Alex's earlier shows when all of the H1N1 was first emerging, I had searched the CDC site. I researched things that were in one of the most prestigious of our science magazines, which is called Science, and Nature, and the New England Journal of Medicine. Early on, the evidence was that this was a very difficult virus to transmit, that its virulence was no worse than any other ordinary virus, and that this whole thing was being overblown. Then it came out by the CBS study, which they looked at all the different states and found out the vast majority of the viral infections were not H1N1. something like 90% in some states, 99%, were other viruses.